Welcome back to Animal Husbandry Motivation Movement channel. Today let me discuss with you about infectious disease that is also known as Gumbaro disease. Infectious bursitis and infectious avian nephrosis is a highly contagious disease of young chickens and turkeys caused by infectious bursal disease virus characterized by immunosuppression and morbidity generally of 3 to 6 weeks of age. Species is infectious bursal disease virus, family Birnoviridae, genus Avibirna virus, realm is Riboviridae. Pathogenesis: infectious bursal disease virus enter through oronasal route, replication in oropharynx, then viremia, target organs, that is Bursa fabriceus. It affects less than 3 weeks old chicks. Lack of sufficient complement in early life up to 2 weeks old of chicks. No clotting defects in 17 days old chicks. No Arthus type of reaction develops. Reaction as subclinical infection. 3 to 6 weeks old chicks. Formation of immune complex produced localized immunological injury. Arthus type of reaction followed by necrosis, hemorrhage and polymorphonuclear leukocytes infiltration. Then coming into increased clotting time, subcoagulopathies would contribute to the hemorrhagic lesions. Destruction of B cells, immunosuppression with impaired antibody response, consequence subclinical response to vaccine and lowered resistance to disease. Coming into mortality pattern, in broilers, mortality between 3 to 6 weeks, generally 2 to 5% of mortality, rarely goes beyond 10%. Peak on second and third day, no morbidity on fifth day. In layer, mortality between 7 to 12 weeks, generally 30 to 70% mortality. Mortality runs from 7 to 14 days. 2 peaks mortality, that is at 3 to 4 days and 7 to 8 days. In unvaccinated flock, 90% mortality. In cage layer, high mortality will be noticed. Clinical signs: sudden death, tremor or unsteadiness, depression and anorexia, ruffled feathers, droopy appearance when pecking, diarrhea and dehydration, straining during defecation, sometimes voiding blood in feces. Diagnosis: history, clinical signs, postmortem findings, different cell diagnosis, coccidiosis, Newcastle disease virus, vitamin A deficiency, fatty liver, kidney syndrome and hemorrhage syndrome in muscles. Confirmatory diagnosis: isolation and identification of the causal agent, then through ELISA test. Treatment: no specific treatment. Supportive measures: increasing heat, ventilation and water consumption are beneficial. Vitamin and electrolyte therapy, multivitamin supplement. Antibiotic: high levels of tetracyclines are contraindicated because they tie up calcium therapy producing rickets. Vaccination: 2 types of IBD vaccines are used. Live vaccines, mild vaccine, standard intermediate vaccine, intermediate plus vaccine, hot strain vaccine, then killed vaccine. Then vaccination schedule. In broilers, primary we have to give vaccination the 7th day, booster for 21st day. That is method of administration, eye drop or with water. Then coming into layers on 14th day and 21st day, then revaccination at 16 to 20 weeks of age. Method of administration, eye drop or with water. For breeder hen, traditionally or pre-lay stage and mid-lay stage IBD inactivated vaccine is given to get high antibody titer. Some commercial vaccines: Nobilis Gumbaro D78 intervet, Nobilis Gumbaro 22-228E intervet, Sevac IBDL, Seva Limited, Gumbaro Med Incepta, Isovac Gumbaro 2, Renata. Immunity: we have to develop immunity against IBD virus. How? through active immunity, that is natural infection vaccination with either live or killed vaccines. Passive immunity, antibody transmitted through yolk of the egg. Passive immunity protects the chicks against early infection. Half-life of the natural antibody is between 3 and 5 days. Thus, if the antibody titer of the progeny is known, the time when chick will become susceptible can be said. Then control, strict biosecurity, thorough cleaning and disinfectant of the houses between the flocks, and the practice all-out management. If delays infection, also provides a time for vaccines to produce immunity. Hygiene and sanitary precautions, formaldehyde and iodophores are found to be effective disinfectants. Removal of vectors like the mealworms and rats. Proper vaccination of birds and flocks.